Wellstar is centered around the northwest part of Atlanta. We have a total of 11 hospitals and multiple clinics distributed through the area, and we have 7 multidisciplinary lung cancer clinics, which we call STAT clinics, which is short for Special Treatment Assessment Teams. And this is with the goal of improving access for patient care closer to home.
So there's 3 ways that a patient can come into a STAT clinic. One is directly referred by their doctors, or they come in by themselves. The second way is our lung cancer screening program will identify a spot that is very suspicious for a cancer, and then they're directed into our STAT clinic. And the third way is through our incidental nodule program, which when you get a scan that is suspicious for a cancer and it's highly suspicious, it'll get bypassed from any biopsies and brought into the STAT clinic to discuss your options. The other part of the incidental nodule program is we're not sure yet that this is a cancer, and so we need to set up a biopsy and then other testing. So we'll go through that process and confirm it's a cancer and then bring them into the STAT clinic.
Usually a patient navigating through a cancer diagnosis will have multiple visits with significant lag between the visits to see different providers and specialists along the way of their journey from detection all the way to treatment. So what we try to do here at Wellstar that I think set us apart very uniquely is that we try to put the patient at the center, and we have the physicians come to the patient so that we can expedite their entire workup so that the journey from the beginning to the end, it's much shorter, and the patient supported through the way to minimize the anxiety caused by such a terrible diagnosis. So national average from detection to treatment is somewhere between 6 to 9 months. And here at Wellstar, we've been able to decrease that to about 3 to 4 weeks by bringing the patient in a multidisciplinary coordinated care from the very beginning.
The sooner we get identification of a cancer, that means the sooner we get a lower stage. And a lower stage always ends up being improved survival. And therefore, time is of the essence for survival in early detection.
STAT clinic improves both experience and quality of care by having all the providers there at one setting. The patient doesn't have to take time to go to multiple different appointments. He or she can come to one setting, meet all the physicians responsible for care, hear the care plan from all the physicians together, and get on their treatment much quicker than they would in a traditional setting.
Lung cancer in particular often involves treatment with surgery, radiation, and chemotherapy or immunotherapy. It's one of the diseases where the most clinicians are involved, and so because of that, having all the clinicians together at the same time to discuss a care plan and to discuss that with the patient so that they're satisfied and happy with the treatment options that have been presented is critical in lung cancer management.
So whenever a person gets conversation of cancer, it's like their life falls apart. There's no ceiling, there's no floor, and it's quite confusing. And so if we can get them some kind of ground to stand on by giving them a plan, a task, goal marks, they have more control over this disease process. And it's not so nebulous, it's conquerable.
When a patient enters this program, they're usually feeling anxiety and fear. My role as a nurse navigator is to be there for them through their journey from beginning to end, through diagnosis, treatment, and beyond their treatment. I offer them patient education, support, and also I advocate for the patient for better care. What I hear most from patients is that they're relieved. They leave our clinic knowing what their treatment plan is and what their diagnosis is and how they're going to be treated. And they see the group of individuals working as a team, and that makes them feel good.
My mother went to the STAT clinic, and the benefit of that to me as a caregiver was I didn't have to take off as much time of work. I brought my mom to the STAT clinic, and she saw everybody at one time, which allowed me to streamline things as a caregiver.
The multidisciplinary clinics provide the best possible individualized care for our patients with cancer.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.